Yeah, the major focus of my lab is to develop rapid diagnostic tests for infectious diseases. So we use the dipstick test, like the COVID test, and what we try to do is try to figure out what a bacteria or a virus may be shedding into a patient's sample during an infection. So once we do this, we can make monoclonal antibodies or that bind to these diagnostic targets and make these quick rapid diagnostic tests. The major challenge that we'd like to address is how do we use these tests in resource-poor settings. So my favorite project is to try to develop these diagnostics for use in places where they don't have high technology like the United States. So we can get a diagnosis pretty rapidly in the US, but in places like Africa, South Asia, Southeast Asia, it's a little bit more challenging. So if we can use these dipstick tests to try to diagnose infections quickly in these regions, we really have the potential to save lives. So the biggest influence, I think, the thing that brought me into research the most was working at Children's Hospital in Boston after I graduated from undergraduate. And we worked with cystic fibrosis patients, and those patients have chronic lung infections. So they have bacterial infections in their lungs. And so this was very frustrating because I saw a lot of young children suffer from this disease. And so I think that really motivated me to go to graduate school and study infectious diseases. So what hobbies do I enjoy? I definitely like hanging out with the family, snowboarding, playing tennis, outdoor stuff. Reno is great for that year round. So that's what I like to do.